Good morning, good afternoon, good evening. I hope you're all doing well. It's just gone midday here in the UK. So we're here to talk about the head doctor. I thought he was interesting, the neurosurgeon. That was an interesting guy. Not quite sure what he had to add. Not quite sure why the Commonwealth called him, because he did just as much good for the defence as he did for the prosecution, in my opinion. But we're here to talk about him. I'm going to play his entire testimony because it's not long and we're not under a time restraint today, because Judge Bev has given the jury the entire day off because they're ahead of schedule. I can't believe how they are. Like, I just feel that Hank isn't bringing his witnesses in, like, appropriately. Like, they could easily have done another witness yesterday. Like, did Hank not have any, like, witnesses that would take, like, half a day or less? Maybe not. Maybe. See, I'm not really sure how many more witnesses Hank's going to call, because he's not been calling them in a logical order, really. And maybe there's only Welcher left. And Welcher's going to take a while. And Hank did say that Welcher is coming in early next week. So I think maybe the Commonwealth's case is going to end with Welcher. Welcher's going to be the big wow moment for Hank. That's what I'm feeling that Hank is thinking. So the jury now have got, because it's Memorial Day weekend. We don't have that here in the UK. We don't have Memorial Day. But they were meant to have half a day today and then Friday off. But they've also got Monday off. So there's no trial now until next Tuesday. After the head doctor, what I feel I want to do is go back and listen to Scotty Bellow's testimony again. So if anybody fancies a live stream tomorrow going through Scotty Bellow's testimony, like the medical examiner, I think I'm going to do that because I want to listen to it all again. So we might as well do it together. What do you think? I think that's what I'm going to do tomorrow. All right. So today I'm not going to talk about she's so frustrating, Christina Handley. She's such an irritating person. I'm sure she's lovely. I'm sure she's lovely in her regular life. But I can't be dealing with people who can't answer yes or no questions. Like, there were so many questions that she could have just answered with yes or no. But no, she has to have this long-winded, very slow way of speaking. And she goes, so, and then she's umming and ahhing and she's checking her notes. And I was listening to it live, so I couldn't even speed it up. So I'm not talking about her at all. I don't think it's useful. I don't know why there's so much time spent on it. There was in trial 1, because it's obvious to anybody that Proctor has got his hands all over this evidence. So it doesn't tell us anything. It doesn't tell us that the tail light or the glass broke because Karen hit John O'Keefe. Even if some of the pieces match, so what? It's just pointless. And we know that Proctor has added pieces of glass and a hair. We know it is. Look, it's obvious. It's obvious. So not going to even waste my time or your time. If you want to go and listen to that again, be my guest. But you're not going to hear it on this channel. But the head doctor, he was nice. I liked him. Again, I don't really know why the Commonwealth called him. Like, was he a witness who was willing to say what Hank wanted him to say? I didn't get that impression, because his testimony was just as good for the defense as it was for the Commonwealth. So, I don't know. But I thought it was interesting. Let's see who's in the house. Angie Baby, Professor in Mathematics and Science. Windy Weather, hello. Hello, McKenna. Well, good question. How long has this trial got left? Well, as I said, Welch is coming in early next week, so that'll be Tuesday. So it depends on how many more witnesses Hank's going to call, or whether it's just Welcher left. But Hank did say that he's going to rest his case next week, like early next week. But I think Welcher's going to be on the stand a full day, if not longer, I feel. And then the defence case, don't know, maybe they've got scheduled like 2 weeks, but I don't know. But given the amount of breaks that Bev gives the jury, and given the amount of time she wastes leaving early every day, we could be here this time next year. Who knows? It's done when it's done. Done when it's done. 3 to 4 weeks, you say? I think it's going to be maybe less. I think maybe 3 weeks. If you give the defence case 2 weeks, Siaka's going to take a while. They've got their medical experts, so yeah, maybe 3 weeks. Maybe a bit less. I don't know, honestly. Hello, CW. Down Under with Love. Hello, Peter. Danny takes a trip. Quiet Observer. Canoni's baloney. There's a lot of that. I wonder what beef she had with the jury yesterday. We could speculate for a while on that, couldn't we? I think, my personal opinion, is that jurors have been talking to each other about the case. I think maybe they've been expressing opinions. I know there was a couple who kept laughing, like reporters in the courtroom said that there's a couple of jurors who've like kept laughing and giggling to each other. So she did have a word with them, didn't she, a few days ago about listening. So I think maybe one juror's overheard other jurors talking and she's just reminded them. But none have been struck, so still got the full gamut of jurors. They've not even lost any alternates yet. There's time. Seen lots of folks saying that Dr. Wolf was arrogant, but not going to lie. I'd be all up myself if I was a brain surgeon. Do you know what? There's a lot of neurosurgeons, a lot of neurologists who they have that reputation of being quite arrogant, because they deal with people's brains. So they feel like they're playing God. I don't know whether that's true. I've seen a few neurologists and neurosurgeons in my time because I've got a dodgy brain. And actually, I think I've seen 2 neurosurgeons and maybe 2 neurologists, 3 neurologists. Didn't like the neurologists, but the neurosurgeon at Preston Hospital, I thought he was really nice. I had a really good chat with him. And he didn't come across as arrogant at all, but I don't know. But yeah, maybe he was a bit, but I thought he was quite neutral. Obviously paid by the Commonwealth, probably paying him handsomely to take a day off his brain surgeries. But I don't know whether Hank intended it to be, but in my opinion, his testimony was just as good for the defence. Anyway, hello, Melissa. Who else have we got in? Raven from Australia. Janine, hello. Patrice, Lisa. Two Arctic Wolves. Leslie. All right. We are all done. Let's get on with this then, shall we? Without further ado. All right. Now, I'm playing it all because it isn't long and I want to listen to it again. I've only heard it through once. I've heard a few clips, like what the news have played, and I watched Lawyer You Know last night. I've watched Duty Ron this morning. So I've heard the clips that they've played, but I want to listen to this all again and comment on it. Okay, let's go. I've also got some demonstrative aids. I thought one thing that could have made this testimony better was if they got a diagram of the brain, because he's talking about like parts of the brain, and unless you're an expert on anatomy, then it's just all going to go over your head, isn't it? I thought Hank could have brought in a nice demonstrative aid, like even a model, you know, like you're doing anatomy classes. Like back in the day, I did A-level biology, and we had like this model of the brain, like you could take the top off. It was cool. Or something like that would have been helpful. But the prosecution don't seem very good at that. I mean, look, not talking about the pieces and the taillight and the glass, but that aid that the defense that Alan Jackson put up when he was cross-examining, I thought that was perfect. Like a little diagram with what pieces matched, what didn't. Prosecution don't seem very good at doing things like this. So I thought a demonstrative aid for the head doctor would have been very helpful. But it is what it is. All right, let's go.
Mr. Brennan.
Thanks. Thank you, Your Honor. Commonwealth calls Dr. Wolf.
So we've got two Dr. Wolves. We've got this Dr. Wolf, and we've also got Dr. Wolf with Arca, but they're spelt differently, I think. Dr. Wolf with Arca, I think, has an E on the end of his name. Maybe, possibly. But just so nobody gets confused, we do have two Dr. Wolves in this trial.
Raise your right hand, please. You solemnly swear the evidence of the court and jury in the case now and hearing to the truth, the whole truth, and nothing but the truth, so help you God. I do. Thank you.
Good morning, doctor.
Good morning.
All right, whenever you're ready, Mr. Brennan.
Thank you, Your Honor. Good morning, sir.
Good morning.
Could you please introduce yourself to the jury, spell your first name and last name for the court reporter?
Sure. My first name is Isaac, A-I-Z-I-K. It's phonetic. Last name is Wolf, W-O-L-F, like the real thing.
What do you do for a living?
I'm a brain surgeon.
Is there a special part of medicine that you study?
Well, my main interest in brain surgery is brain tumors and trigeminal neuralgia, but I also specialize in movement disorders. I do pediatrics and adults.
Are you an active working neurosurgeon?
I am a very active working neurosurgeon. I get up every day at 4:30 in the morning to go to work. 5 days a week. I take call 300 days out of 365 days a year.
I don't think we need to know his holiday schedule, honestly. I don't think we need to know what time he gets up. Bless him. So he's very busy. He's a busy man. I think that's what we can conclude.
Did you work yesterday?
Yes, I did.
What type of work did you do yesterday?
I did 2 brain surgeries yesterday.
Are you working tomorrow?
I have 4 surgeries scheduled for tomorrow, which is why this is a little bit delayed for me, and I have 4 on Friday.
And what type of surgeries do you have tomorrow and Friday?
So he works fast. 4 brain surgeries in an entire day. That's fast working. You kind of think, well, brain surgery, maybe it's very intricate and maybe it takes forever, but you can do 4 in a day. Cool. Maybe not all brain surgery is like what you think, like an entire head cracked open. They can do a lot of it with very small holes these days, can't they?
I have 3 brain tumors, 1 trigeminal neuralgia, and on Friday I have 4 patients with movement disorders.
You're here today as a witness. How much of your practice, how much % of your income is from being a consultant or a witness for a case?
Probably less than 1%. I don't do this for a living.
I want you to take us through some of your education and background. Could you share with us?
Oh, Hank wants to talk about this guy's education and background. notably missed from Shannon Burgess's direct testimony.
Where you went to medical school and where you graduated from.
I went to Yale Medical School. I graduated summa cum laude.
Was that in 1981 that you graduated?
Correct.
After medical school, did you begin internships in medical residency?
I did an internship at Hennepin County Medical Center, which is a trauma center in Minneapolis. I then did 5 years of neurosurgical residency at the University of Minnesota.
And was that in Minnesota?
Correct, in Minneapolis.
Is there something about that hospital that has some specialty?
It was one of the #1 training centers for chairmen in neurosurgery at the time.
Did you, in your residency and in your fellowships, do any work or study in pathology?
During your residency as a neurosurgical resident, you do 6 months in neurology, you do 3 months of neuroradiology, you do 3 months in pathology, which includes autopsies on brains. And then you do rotations through a trauma center as a chief resident, through a VA hospital, and then ultimately at the university hospital for elective cases.
Yeah, but that was a long time ago. That was a long, long time ago. So he is not a forensic pathologist. His job is operating on and treating living brains. So let's just remember, he is not a forensic pathologist. He's not a medical examiner. He's working on a lot of brains, but lots of different types of situations with these people, but all of them living brains.
We also do 6 months of pediatric neurosurgical residency.
Did you do a fellowship at New York University?
Yeah, at NYU, I did a fellowship before I went to the University of Maryland as a professor in brain transplantation. The interest was in using cells to create dopamine centers in rat brains with the concept of Parkinson's being curable with transplantation.
I'd like you to take us through some of your faculty positions, and so you can share with us some of the progression of your training and experience. And did you begin at the University of Maryland Hospital?
Yes. In 1987, the University of Maryland recruited me to start their epilepsy.
So we're in the 1980s. So when he did pathology, it's in the 1980s. So that's a long time ago.
Surgical program and skull-based program. And then part of our responsibilities as assistant professors was to cover shock trauma.
Could you explain for us what shock trauma means and whether the University of Maryland Hospital was a shock trauma hospital?
So the University of Maryland and shock trauma were actually two separate entities when I started. A man named Cowley had basically developed the concept of the golden hour. So prior to Dr. Cowley, most trauma was just taken locally. That meant as a community hospital, if a patient had been in a motor vehicle accident, they needed an orthopedic surgeon, they had to call the orthopedic surgeon in, could take 15 minutes, could take 3 hours. The same thing for a vascular surgeon, the same thing for a neurosurgeon. Dr. Cowley came up with the concept that you needed a center that was strictly for trauma and every attending had to be in the hospital 24/7. So that was the concept of shock trauma back in the 80s. When I got there, we were transitioning from a very small center to a 125-bed hospital that was completely committed to trauma.
In that experience, in the years you worked there, did you have an opportunity to treat a number of people with brain injuries?
We treated well over 100 patients a month, basically, with brain injuries at shock trauma, along with spinal cord injuries.
Did you perform surgeries in different types of brain trauma and brain injuries?
Yes.
After Maryland in 1993, did you move to Miami Neuroscience Center?
Yes. In 1993, I left academics. I went into private practice in Miami, and I started the Miami Neuroscience Center. We were the first private community hospital to have what's called the Gamma Knife. So we were the 13th in the country, but the only one that was non-university based. And Gamma Knife radiosurgery is using radiation to operate on the brain.
Are you presently the director of...
Look, I'm not a neurosurgeon. I don't fancy having radiation used as a way to operate on the brain. I'll believe him. I'll believe him that that's safe.
The Miami Neuroscience Center at Larkin Hospital?
Yes, I am.
You conduct a number of surgeries a year there?
Correct. So I spent 19 years at Doctors Hospital, then we moved to Larkin Hospital 13 years ago, developing the new radiosurgical unit called ZAP, and also another fancy machine called high-frequency ultrasound to treat the movement disorders.
You've noted that you have a number of professional memberships. I don't want to go through all of them. I'd like to point out a few. Are you a professional member of the American Association of Neurological Surgeons?
Yes,
Are you a member or fellow American of the College of Surgeons?
yes,
Are you a member of North American Skull Base Society?
yes,
And is that brain related?
it is.
Are you a member of the Society for Neuro-Oncology?
Yes,
Are you a member of over or at least 34 different professional memberships?
yes,
In your career, have you engaged in research?
yes,
Has that research focused or centered on brain injury?
yes, it has.
Is some of your research as a principal investigator for THAM treatment of brain tissue acidosis in severely head injured patients?
Yes,
Did that research and as a principal investigator help you in your diagnosis and treatment of brain injuries?
it actually was in the treatment of severe head injuries, patients who are unconscious, the concept of trying to relieve the increased intracranial pressure that occurs from the injury and to increase blood flow, thereby increasing oxygen to the brain.
Did you also serve as principal investigator for research for the PEG SOD in severe head injury?
Yes,
Could you describe that very briefly?
basically the same, one of the biggest problems in brain injury.
Well, Brennan is spending a lot of time on this guy's experience. Rightly so, because he's very experienced. He is probably one of the, if not the most eminent witness that Brennan has brought on. But we do have to remember that his knowledge is very specific. I mean, it's broad in that he treats, and over many years, he's treated a lot of different types of brain disorder, but it's specific in that he's now in private practice and has been there a long time treating living patients. That's his job.
Is the fact that blood flow ceases to exist as the brain swells up. And so one of the things we try to do is preserve the neurons by making sure that they have enough oxygen and blood flow to them. All these are agents that try to assist that.
I won't go through all of your research and principal investigator roles, but I want to ask you about one more. And that is, did you serve as principal investigator relative to the IRB protocol for brain pathology?
Yes.
And what did that do? What was that about?
It was about looking at what happens after a brain injury to blood vessels and tissue as the intracranial pressure increases in the brain.
Have you been part of publications of a number of different books?
Yes.
I won't list parts of all 16 books, but can I point out a few?
Sure.
Were you the author of a book chapter regarding head injury, difficult medical management?
Yes.
Were you the author of a book chapter on pediatric neurosurgical emergencies?
Yes.
Were you the author of a book chapter on complications of head injuries in adults?
Yes.
Were you the author of a book chapter, Imaging of Craniocerebral Trauma?
Yes.
Were you an author of a book chapter in emergency room assessment of the head injury patient?
Yes.
Were you the author of a book chapter, Intracranial Injuries?
Yes.
I won't list or ask you about the other book chapters that you've been the author of. Have you been involved in journal articles?
Yes.
I'd like to ask you just about a few of the 70 journal articles that you have published.
Your Honor, objection.
So go ahead and ask the question without a comment first.
Were you an author of a journal article, Intracranial Pressure in Non-Traumatic Ischemia and Hypoxic Cerebral Insults?
Yes.
Were you the author of a journal article, Post-Traumatic Cerebral Infarction?
Yes.
Were you the author of the journal Fractures of the Clivus?
Yes.
Could you tell me a little bit about that paper?
We used thin cut CT scans to identify fractures of the skull base. Prior to CT scans, it was very difficult to actually identify radiologically a skull fracture with plain X-rays. The idea was to see if we could identify them more clearly. And so we classified them and delineated them in the paper and discussed the outcomes that were relative to those type of injuries.
All right, so that's relevant. That's relevant to John O'Keefe because he had skull fractures. That's relevant. Good.
In the last journal article I'll ask you about, were you the author of a journal article regarding acute traumatic midbrain hemorrhage?
Yes.
Okay, that's also relevant.
Were you the presenter in a number of presentations regarding head injury and brain injury?
Yes.
You've listed 93. I'll ask you just about a few. Were you a presenter in fractures of the clivus, clinical and radiographic features?
Yes.
Am I pronouncing that correctly?
Clivus.
Thank you. Were you the presenter in acute head injury?
Yes.
And a separate presentation, fractures of the clivus, classifications and clinical features?
Yes.
Do you lecture?
Yes.
Do you have peer-reviewed publications?
Yes. That was one of them.
Thank you. And are you heavily involved in clinical research?
Right now, my research is more based on radiosurgical techniques and outcomes.
Over your career
Can we get onto this case now, please, Hank?
in your study, in your clinical experience, have you treated different types of brain injuries?
Yes.
Are you familiar with a number of different types of brain injuries?
Yes, we still treat them.
Were you asked to review materials relative to this case?
Yes.
And do you
Oh,
recall-
woo. How many minutes has he spent on training and experience? So like 12 minutes. Compare that to Shannon Burgess. 0 minutes, 0 seconds.
Called materials that you reviewed?
Yes.
Could you share with us some of the materials that you reviewed?
I reviewed the chief medical examiner's assessment of the case. I reviewed pictures that I'm assuming the medical examiner took of the autopsy. And I reviewed the report from the forensic pathologist.
And before I ask you about your review of specific materials and your opinions in this case, is there a benefit to your clinical experience in studying brain injuries as opposed to the experience you had as a fellow simply with pathology?
Well, I think that for the jury to understand is a clinician understands the process from the time the injury occurs till the patient either leaves the hospital or dies. And it's a process. And as a neurosurgeon, I have a tremendous amount of experience with that, if that's what you're asking me.
Yes.
And that is useful. That is very useful because John O'Keefe was alive. He didn't die immediately. So the process from going from the head injury that he received to his death happened over a period of time. Now, we don't know how long, but I can understand why this guy has a unique perspective to share with the jury above and beyond what Scotty Bello could tell us. So I do think this is beneficial. But again, it's just as much of a benefit to the defense as it has been to the prosecution. And if you remember, if you saw yesterday's live stream where I said, what I kind of do when I'm watching trials is think about the jury coming in neutral, like they should come in neutral. Actually, they should be airing on innocent. This person is innocent till proven guilty in a court of law. But we know that people don't. You know, people think, well, they've been arrested, they've been charged, they're here for a reason. So, you know, you have to weigh them both. So let's imagine that the jury comes in neutral and open-minded. How much does each witness turn that dial towards either innocent or guilty in each juror's mind? And with someone like Shannon Burgess, I don't think he moved the dial at all. Now, this guy, I don't think he moves the dial, honestly. Like overall, because we're towards the end of the Commonwealth's case now. So I'm imagining that most of the jurors will have already formed somewhat of an opinion. They shouldn't. They should wait until all the evidence is done, but that's just not how humans work. So I think if you've already got it in your head that you're erring towards guilty, then you're going to take what this guy says and you're going to say, okay, it fits. It fits that this injury was caused by him hitting the ground. So if you've already got in your head that Karen Reid struck John O'Keefe with her vehicle, then John O'Keefe's fatal injury was caused by him being hit by that vehicle and then hitting the hard ground. So that's your confirmation bias. That's how you're taking what he said, tailoring what he said to what your opinion already is. But equally, on the opposite side, if you're erring towards Karen Reid is innocent, that there was no collision, then you're also going to take what he says and mold that into your opinion and say, well, okay, he hit the ground. We know he had a fatal injury to the back of his head. So if he wasn't hit by a baseball bat or a dumbbell or whatever, then his head injury had to be caused by him falling backwards. But if you've already got it in your head that no collision occurred and Karen Reid could not possibly have hit John O'Keefe with her vehicle, then John O'Keefe's injury had to be caused by something else, a fall of another kind. So it overall, he doesn't move the dial either way, because there might be some jurors who are erring towards guilty, some jurors who are erring towards innocent. So overall, he doesn't move the dial, in my opinion, because you can take pieces of what he said and fit it with the prosecution's case, or you can take pieces that he said to the defense case.
So, Doctor, you reviewed a number of items of information in this case. Did you have an opportunity to review photographs of a laceration to Mr. John O'Keefe's head?
Yes, I did.
With the court's permission, I'm going to ask to display Exhibit 160.
Okay.
So we don't see the head injuries, but what I do have is, this was a mock-up. This is just a screenshot that I took from Court TV, and they've done a mock-up. So that's the measuring thing. That's the laceration. So they shaved his head. So the white that you're seeing is where his head's been shaved, and then this is the laceration. What you can't see on here is any bruising. And we know there was bruising. Well, bruising happens in a living person. If he died immediately from this injury, he wouldn't have bruised. There wouldn't have been any bruising, because you bruise when you're alive. You can't bruise when you're dead. So we know he was alive for a period of time for bruising to develop.
Dr. Wolf, I'm going to ask you to take a look at this photograph. Have you seen this photograph before?
Yes.
I want you to explain to us what you're seeing here and take us through the process of your observations.
Well, what we're seeing is an approximate 1.5 inch laceration with bridging tissue and contusions and abrasions. To us, that's just a classic blunt trauma injury. There's nothing other than just vanilla about it. This is what happens when soft tissue hits a solid ground.
So everybody for the prosecution goes, yes, this was caused by him hitting the solid ground. That means that Karen Reid must have struck him and he hit the ground with his head. No, it doesn't say that he got this injury from being hit by a vehicle. None of his injuries are consistent with him being hit by a vehicle. But he fell backwards and hit his head. So you can fall backwards and hit your head just by walking along and slipping on a banana skin or slipping on ice or falling backwards because you've been pushed or punched and you fall backwards. And it doesn't mean to say that you've got to hit the ground. All you've got to do is hit a solid surface. It doesn't have to be the ground. You know, like this guy is, I think he's pretty neutral. However, he's being paid by the Commonwealth. He's a Commonwealth witness. And he will have been told how John O'Keefe was found. So you have to think about other ways in which John O'Keefe could have fallen backwards. And what Hank said the other day, and I made this point at the time, Hank said that the grass stains and the mud and the dirt stains on the back of John O'Keefe's jeans was as a result of him hitting the ground after the collision. But that means he landed on his butt. And if he landed on his butt enough to get grass stains on the back of his jeans, how on earth then did he get a head injury that was so serious that it caused multiple skull fractures and John O'Keefe's death? Because landing on your butt breaks your fall. And we know that that didn't happen. He would have had bruising. He would have had injuries to the lower part of his spine. But he doesn't. He didn't have any injuries, no bruising, nothing to that part of his body. So we know what Hank was saying was absolute nonsense. So how did John O'Keefe get grass stains on the butt of his jeans? I think it's because he was dragged. That's how you get stains, when you're dragged. Or he falls, like maybe he falls against a wall. So he's not falling on the ground, he's falling against a wall. And then he's kind of upright, like in a seated position for a while. So he's already got the head injury, but his butt's on the ground, and that's where he gets the grass stains from. But people from the prosecution will have gone, yes! Like so many people have punched the air that this like eminent brain surgeon has said that John O'Keefe hit the hard ground. But what he hasn't said is John O'Keefe hit the hard ground as a result of a motor vehicle collision.
The skin tears apart a bit, but not through and through. As you can see, there's the bridging. You can see all the bruising or contusions and just the tear, a little bit serrated along the edges.
Thank you. If you could take that down. Dr. Wolf, as a result of that wound, did you have a chance to further look at information provided to you about the actual inside the skull of Mr. John O'Keefe?
Yes, it was the pictures that I was reviewing showed a Now
this is where I think Hank should have used a demonstrative aid for the jury, because this guy starts rhyming off a lot of different areas in the brain. So unless you understand brain anatomy, this is going to go over everybody's heads. I mean, all right, Hank could have broken it down and got him to explain in more detail where each of these places were. But I think a demonstrative aid would have been so helpful. But I don't want to help Hank with this case, but if I was on the jury, I would have welcomed a demonstrative aid at this point.
Depressed skull fracture extending linearly through the clivus and into the frontal fossa of Mr. O'Keefe over the orbital roofs. He had fractures along the temporal fossa as well. So it was a...
So people are going to be like, well, what is the fossa? What is the orbital roof? What does this mean? Won't they, though? So I've got a demonstrative aid. I've actually got two. This is the normal kind of brain anatomy diagram that you get. Like, this is brain anatomy 101, right? So this is the cerebral cortex, and you've got the frontal lobe at the front. So your face is here, right? So this is your forehead here. you've got these lobes. So you've got frontal lobe, that's where your personality is, parietal lobe, temporal's at the side, and then occipital lobe, which is at the back. So John O'Keefe had his injury at the back here. Right, and then that's the cerebellum, and you've got your brain stem. The spinal cord goes up through the foramen magnum, which is the hole that your spinal cord goes through into your brain, and then that becomes the brain stem there. But that's brain anatomy 101. What he's talking about, though, are the fossa. Now, the fossa are, it's like the floor of the brain, if you will. So that the floor of the cavity that the brain sits in. So when he's talking about the anterior fossa, he's talking about the floor of the cavity at the front of the brain. The temporal fossa, what's this doing? Website uses cookies. Okay. And then you've got the temporal fossa, which are at the sides, and then you've got the posterior fossa, which is at the back. And then the orbital roof is at the front, like at the top of your eyes. So, floor of the cranial cavity is divided into 3 distinct depressions. They are known as the anterior cranial fossa, middle cranial fossa, and posterior cranial fossa. Each fossa accommodates a different part of the brain. The anterior cranial fossa is the most shallow and superior of the 3 cranial fossae. It lies superiorly over the nasal and orbital cavities. So it's at the front. It'd be like at the bottom of your forehead kind of thing, but like inside. The fossa accommodates the anterior, I can't read that, portions of the frontal lobes. So if you look at the brain diagram 101, frontal lobe, so then you're talking about this area, like, because your face is here. This is like the bottom of your forehead. So your face is here. But the jury, if you don't know anything at all, if you've never done anatomy or anything at all, you've no clue what he's talking about. You can't visualize it, can you? You can't visualize it without having some either knowledge of anatomy or a diagram to help you.
Classic linear basilar skull fracture.
Is basal skull fracture a
It's
characterization?
basically the base of your skull is what it encompasses. So the opening at the very bottom is what we call the foramen magnum that connects your brainstem to your spinal cord.
All right, so foramen magnum. All right, so spinal cord. So this is coming up from like your spine. Foramen magnum is like here, right here, and that's like the hole. And then the spinal cord goes through the foramen magnum, through the hole, and then it widens out and becomes the brainstem. And then you've got your cerebellum that sits on top of the foramen magnum. Foramen magnum's about here. Sidebar, I have a condition called Chiari malformation. And it's a brain, like they say you're born with it, but I didn't have symptoms for like throughout my entire childhood. But basically, part of the cerebellum falls through the foramen magnum. So the cerebellum slips down and it can cause pressure on the brain because the cerebrospinal fluid can't move freely. And if it slips too far down, it can cause serious problems because it can cause like damage to your spinal cord. It causes balance issues. That's why I fall a lot. Because I have no balance. But yeah, that's why I know a little bit about brain anatomy in this area. Well, actually, I know a bit about brain anatomy anyway, but there you go. I've never had surgery. Last time I had an MRI, which was back in 2012 maybe. Yeah, 2012. I had I don't know whether they call it a prolapse, but a slippage of, it was on the cusp. It was like borderline needing surgery. But they decided not to do the surgery because they thought they might make them worse. And the neurosurgeon that I saw, he said he would never operate on me. Because I have what he termed a kinky brainstem. So I think the problem has been that I've had this Chiari malformation probably since I was born, but no one knew. And as I grew, I think it's caused a kink in my brainstem because of the pressure of the cerebellum on the brainstem, and it's kinked it. So he said if he went in there rummaging around, he could kill me. So he said he would never operate on me. But that's just one person's opinion. Maybe if I needed surgery, maybe if I was on the cusp of being paralyzed, then they may do it, but I don't know. But I haven't had a MRI for like that many years. I mean, I have no idea what's going on in my brain. But, you know, when my behavior feels strange, you can tell why, because my brain has grown in a way to accommodate this malformation, and it's caused injuries beyond what you'd normally see in a brain. My brain anatomy in this area is unusual. It's working though. Apart from me falling all the time, it's working. Yeah, when he said I had a kinky brainstem, I laughed and he laughed. And I think he realised what he'd said when he'd said it. But I have seen the picture. I have seen the picture, and it truly is kinky. It's like got a bend in it where it just should not have a bend. But it's working. I'm alive. I'm breathing. Like, look, if your brainstem conks out, that's it. You're dead. You can't breathe. Your heart doesn't beat. Nothing. Nothing. So I wouldn't know. If my brainstem packed in, I wouldn't know anything about it. I'd just be dead. So I'm not bothered. I'm just saying. All right, back to this.
And then as your brainstem goes up, it goes into the different skull areas that, you know, talk about what we call the cerebral cortexes, your occipital lobe, your temporal lobes over here, and then your frontal lobes.
So can you walk us through what happens when someone incurs this type of injury to the back of the head, how it happens, and what are the next steps for a person?
So what happens is, you know, you fall backwards, and the linear acceleration starts to take you back down with gravity. The skull hits the ground. It gets, you know, in layman's terms, smashed a little bit. And then the brain moves forward as a response to that. And it moves forward because you have cerebral spinal fluid and because you have the deceleration, acceleration again. As it does, your skull, if you were to look inside your skull, it's like mini mountains along your temporal bones and your frontal bones. So the brain is being thrust forward at a fairly good speed, and it's getting bruised. You can think of it as if you took a hammer to your thumb. It's really turning black and blue. Those are the contusions. And so the temporal poles and the frontal poles are getting contusions because of that. At the same time, you have a space called the subarachnoid space. And I'm sure they're going to hear about the subarachnoid hemorrhage. And that space is it's very clear, thin membrane that covers all of your brain and all of your spinal cord. And normally, you really don't see it unless you open up the brain and you're operating. But when you either have a traumatic event like this, where little vessels are pulling apart underneath that membrane, or, for example, the classic, you know, when you have an aneurysm burst, the space that the aneurysm bleeds to is the subarachnoid space. The other thing that occurs,
All right, so let's break that down a little bit. So you've got membranes on the outside of your brain, right? Like when you get meningitis, that's where the infection is, like the membranes, the meninges. The subarachnoid space is the space in between the membranes and the brain. So if you fall backwards and hit the back of your head, right, then that force of the hit, because your brain is suspended in fluid that protects it, your brain like jolts forward. So if you fall backwards, it's like that that force has got to dissipate somewhere. So your brain like is forced forward. So you don't only have an injury to your back of your brain, you also have an injury to the front of your brain, because the brain like moves forward and it damages those little blood vessels and stuff in the membranes of your brain. Now, your brain itself can't feel pain. Like, they do a lot of brain surgeries where you're awake and they fiddle about in your brain and you don't feel any pain. Like, the only anesthetic they need is on the outside. Once they're in the brain, there's no pain receptors in the brain. So they can fiddle about as much as they want while you're awake. But all the blood vessels on the outer membranes of the brain, then they're going to burst. That's what causes the raccoon eyes, because that blood has to go somewhere. So you're going to get bleeding inside the brain, and you're going to get the development of bruising. So the brain will swell, and you get this increased pressure on your brain, which in itself is enough to kill you. But if you've got bleeding in your brain, then you're not in a good position. Let's put it that way. You're not in a good position, but that's not going to kill you instantly. Now, he does say in a minute, but the way to die instantly is to just take out your brainstem, because your brainstem is the most primitive form of your brain, and it's the place that controls breathing. It's the place that controls consciousness. It's the part of your brain that controls your heart rhythm. So if you shoot yourself in your brainstem, or you get a catastrophic injury to your brainstem, you're dead. You're just dead. There's no time where your heart stops and you then go into unconsciousness, or you drift off. No, it's not. It goes from light to dark. It goes from alive to dead that quick. You are no longer there. Well, that's about the only time that you would ever die absolutely instantly. If you've got damage to the upper parts of your brain, or you've got bleeding inside your brain, you don't die instantly. You might fall into unconsciousness, but you're not dead. Your brainstem's still functioning. So John might have hit the back of his head and become unconscious very quickly, but he didn't die. That injury was not catastrophic to his brainstem. So he would have been alive for a period of time. Now, how long, I can't say, but enough time for bruising to develop, enough time for the raccoon eyes to develop, enough time to have the fractures in his skull to have shown evidence of what comes next. And you wouldn't get that if you were alive, if you were dead. So the consolation to his family is that he probably didn't know anything. He would have been unconscious very quickly, I would think. I think a hit to the back of your head is enough anyway to send you out, but not to kill you. Like when I fell backwards one night because I fainted, and I cracked the back of my head on a desk, And I was completely out cold for I don't know how long. And then I was totally confused, slept for 10 hours, woke up with a cracking headache, and then had concussion for 3 weeks. So, yeah. But I was out instantly. I could have died and not known anything about it. I could have slipped into unconsciousness and died, and I would not have known. Not have known a thing. So, there you go.
In trauma like this is you can get a subdural. So the dura is the membrane that covers the whole brain and also right down your spinal canal. And it's a very thin membrane that looks like very thin leather. And in that space between the brain and the dura can be a lot of veins that go towards a central vein called the sagittal sinus. And if those tear, you have a venous hemorrhage from, which is not arterial, so it's not quick, but that can develop into a subdural as well. If you tear a portion of your brain as well, and you get a little arterial bleeds, that could create a much faster subdural hematoma. And so when you look at the pathology, the autopsy of his brain, you're looking at a subarachnoid hemorrhage, you're looking at a subdural hemorrhage, neither one of them which was huge or would have required surgery, as well as the contusions that I described in his frontal poles, in his temporal poles, and then the original bang, which was in the occipital area. These are all findings that you would.
So the original injury is here. So this is your occipital lobe. This is where your visual center is. And your cerebellum does that's your cerebrum. That's your cerebellum. That does like balance and stuff. Like, because my cerebellum's damaged. Anyway, his injury's kind of there. Like, if you look, I mean, it's a rubbish picture, but it's not really low down. So it is over probably about here, I would think. But the laceration itself, like the cut, is only 1.5 inches. So you think, well, what can 1.5 inches do? Well, it's not the laceration on the outside, it's the fractures and then the result of those fractures that happens on the inside. Think about shaken baby syndrome. That's a kind of a related concept. Like if you shake a baby, they get brain damage, not because of anything other than the inside of the brain rattling around and banging itself on your skull. So it creates bruising, contusions, and it can create bleeds because of the brain shaking around and banging on the sides. So it's a similar concept in a way.
Would see on a CT scan and an MRI scan without requiring an autopsy if he had made it to the emergency room.
I want to take a step back at the beginning.
He did make it to the emergency room. He did go to the emergency room. But I think he was already dead at that point. I think they couldn't declare him dead because they had to warm him up because his temperature was 81 degrees Fahrenheit. So they had to warm him up first.
And you said,
and I still want to do a live stream on hypothermia. So I think tomorrow when I go through Scotty Bellow's testimony, I think that's when I'll talk about hypothermia. I was going to leave that until the defense case, but I think it will be a good time as I'm going to review Scotty Bellow's testimony to talk about that there.
Said that this laceration on the back of his head was caused by a fall. Could this be caused by a fall landing on hard ground?
Yes, I mean, like I said, it's a classic blunt trauma laceration.
Do you have an opinion to a reasonable degree of medical certainty whether this injury, the laceration and the basal fracture, was caused by Mr. O'Keefe falling backwards on the ground?
My opinion is that that's what caused his whole injury.
But it doesn't tell us how he fell. It doesn't tell us anything of how he fell. He could have fallen by slipping on ice or a banana skin. He could have fallen as a result of a push or a punch. You know, just knocked him off balance and he fell backwards and hit his head. and he wouldn't necessarily have hit his head outside. He could have hit his head inside. He could have hit his head on a wall. He doesn't necessarily have to hit the deck. He could have hit his head on a wall. He could have been pushed backwards and hit his head on a wall. It would have given the same injury. It's the same, you know, the force backwards is the same, whether you completely fall on the ground or you fall against a wall, it's still the same injury. Basement floor, yeah, absolutely. Absolutely. But I think he's been told how John O'Keefe was found, and therefore he's saying, well, the injury happened because of this. Which is why all the prosecution people will have punched the air that somebody of his stature has said this.
The pattern of the laceration, do you have an opinion whether that is consistent with hitting the cold, hard ground?
Objection, Your Honor. Can we have sidebar on that, please?
So I'm sustaining the objection.
Yeah, you can't say cold, hard ground. You don't know that it was caused by hitting the cold, hard ground. It's nothing to do with cold, and it certainly doesn't tell us how the fall occurred.
So no sidebar.
Your Honor.
Do you have an opinion, doctor, about whether that laceration on the back of his head was caused by a particular movement?
Well, the only way he could get this kind of an injury was to fall backwards, hit the back of his head, and then the resulting, energy forces going into his brain, into his base of his skull.
Would that type of laceration require Mr. O'Keefe to have hit a line type or ridge type object?
A ridge type of object?
Yes.
No, I mean, like I said, the tearing of the skin in that fashion, you could look it up, would be just a classic blunt trauma injury.
Is there anything about that injury that would suggest to you it had to have been something sharp or ridge-like to cause?
Objection, Your Honor. Begin request kindly a sidebar on this.
All right, we'll come to that.
Thank you.
All right, we've got a sidebar. I don't think it's a long one, so we'll just let them play it out. Seeing it explained like an egg in a glass jar. Shake it till it breaks. Shaken baby, devastating for the brain. Yeah, if you think about a hard-boiled egg, like a soft-boiled egg or a raw egg, it's just gonna crack everything. Think about a hard-boiled egg. So hit a hard-boiled egg, like on a hard surface, and you get radiating fractures all over, don't you? But think about that, but on the inside. Think about that happening on the inside. So the egg analogy is not exact, because it's more about what's going on the inside. Like it causes fractures to the base of the skull, but on the inside. And then the bleeding occurs because the brain shakes around. So the force backwards sends the brain forwards, like just basic physics. And that can cause bruising on the inside of the skull and bleeds on the inside of the skull, which then causes swelling, which causes pressure. That in itself is enough to kill you. But like I said, I think the consolation for his family is that I don't think he lay there for hours in pain. I don't think he was conscious. So he couldn't have called for help. He couldn't have moved. So, but he still would have been alive for a period of time, because it like the brain needs the time to swell and to bleed. So he would have been alive when that process was happening.
So as we were discussing, Dr. Wolf, you said this is a classic fall backwards. Is there anything about the pattern of that laceration that would suggest that there was a ridge or a line type edge that caused that wound?
Not necessarily.
And have you seen in your
Not necessarily doesn't mean no. Like, I hit my head on the side of a desk. Now, it didn't cut my head, but I had a cracking bruise on the back of my head. Probably in around the same place, John O'Keefe's laceration. But the side, like the edge of a desk, like, I can't, it should have cut my head, really, but it didn't. But it totally knocked me out. Now, that wasn't a flat surface, but it was the equivalent of, because it's the crack to the back of the head that causes your brain to like force forward, which obviously caused my headache the day after, and for me to be completely knocked out and then sleep for 10 hours. I could have died. Like, I really could have died. I would not have known a thing about it, though. Like, if I'd had a bleed inside my brain, I would not have known. I would have just have been dead. So, should I have gone to hospital? Yeah, of course I should, but you're talking to me. Yeah, I'm stupid.
experience similar types of lacerations and breaks caused by falling on hard ground?
Yes, you can see that both in the occipital region. You can see it if patients fall on the forehead. The skin tears, they're still bridging, and then they get bruises.
Some of your work was in Minnesota.
Correct.
Was it a colder part of Minnesota?
Very cold part of Minnesota. It's Minneapolis.
I'm sorry. Did you often see these type of injuries there?
Yes, I mean.
Yeah, but that was in the 1980s. Now, I'm not saying that because he had that experience in Minneapolis, that's where he worked in Minnesota in the 1980s, that it's not relevant. Of course it's relevant. But he's been working in Florida since 1993. So I would imagine in Florida, you don't get many injuries caused by people slipping on ice. Whereas in Minnesota, you're probably going to get a lot of people who slip on ice and either fall forward and crack the front of their head or fall backwards and hit the back of their head. So, but brain injuries of that kind haven't changed over time. So I think his evidence of the type of injuries he saw when he worked in Minnesota are still relevant to today. So the brain hasn't evolved to protect itself in the last 40 years.
We took care of a trauma center, Hennepin County. Very frequently, patients that are drunk fall down on ice sidewalks and could develop, lacerations in their head, epidurals, which are blood clots above the dura because they fracture a bone in the temporal area and they can get a bleed from a fractured artery. And it happens when people are shoveling snow and have a heart attack and fall backwards. So there are various ways that people fall, resulting in head injuries and lacerations to their forehead or to different areas of their head.
There you go. So, you could say, and this is why this testimony is just as good for the defense case, because there's lots of ways in which you can fall backwards and hit your head, which then results in catastrophic injuries. If you fall backwards onto something, whether it's the ground or a ledge or a wall even, and you crack your head and you're knocked out and you just don't know. You've got the skull fracture, you're unconscious, you can't help yourself. And if you've fallen as a result of a heart attack, well, we know John O'Keefe didn't have a heart attack, but if you fall as a result of a heart attack, then you've got the effects of the heart attack plus the effects that's going on in your brain. The chances of you dying are pretty high, whether it's from the heart attack that you're not able to get help for or from your head injury. So I bet you saw a lot of that. Or somebody falling because they're shoveling snow or they're walking along and they crack their head on ice. And look, I did martial arts for a long time. And the first thing you learn when you go to martial arts classes isn't moves, isn't self-defense, it's how to fall. So if you're punched and you lose your balance, or you're pushed and you lose your balance, if you learn how to fall, you don't injure yourself from the fall. So a back break fall is where you fall backwards. So let's say if you were punched or you were pushed and you fall backwards, you learn to break fall so that you don't smack your head on the ground and die or get seriously injured because you smacked your head on the ground. The punch is nothing. The push is nothing. The injury comes from smacking your head on the ground. So you learn to break fall, which means you spread your body out. So you land flat, but with your head tucked to your chest. And we did it that many times. It's just completely instinctive. You like slap your arms out and you lift your head up to your chest, and you do that, and you do it so many times that it becomes an instinct. So that's why I never get injured when I fall. I've never been injured through a fall because I've had so much practice in breaking my fall. Same when you go like fall to a side, you don't put, like a lot of people, if they fall to the side or fall forward, they put their arms out. So you'll get like fractures to your wrist or, you know, fractures to your forearm because of the force. No, you've got to put your arms out. You got to slap your arms out. And whether you're falling forward, sideways or back, slap your arms out, and then it kind of cushions you. It literally breaks your fall, and you keep your head out of it. So people, like when I put bloopers on the members area on MichelleAfterDark, people are like, "Oh, take care, like you're gonna hurt yourself." I'm not gonna hurt myself because I know how to fall. And I'm glad that I learned that. It's good. But if you're not able to break your fall and you're punched and you lose your balance, or you're pushed and you lose your balance, the chances of you hitting your head as you hit the deck are pretty high if you don't break your fall. So could John have been punched or pushed? Yeah. I think that's what happened. I think that's exactly what happened. I think that's what caused the injury to his eye. I think he was punched. And unfortunately, he fell backwards and hit his head and he died.
Can somebody suffer this type of injury simply by falling backwards?
Absolutely.
Absolutely. And I would have said, maybe he just fell. Maybe he just fell and it was like a freak accident. He fell and he hit his head hard enough. The reason why I don't think he fell without any intervention from anyone else, however, is because he had dog bites on his right arm. So unless Chloe was out in the front yard, he did not die on that front yard. Or he didn't sustain those injuries in the front yard. Chloe was in the backyard. I'm not quite ready to die on the hill yet, but I'll say I strongly believe John went in the backyard, and that's where whatever happened. Been saying this for a while now, but that's now my favourite top theory, is either he went in the backyard because he was told to, like Brian Higgins was there, like John, come this way. But I don't think he went in the house. I think he was in the backyard. I think.
You had taken us through the process of falling backwards. And
then, that would make sense then of the 2:27 text message from Jen McCabe, How's long to die in the cold. It would make complete sense of it. Now, listen, I don't know whether that text was actually at 2:27 or whether it was 6:23. I don't think any of us will ever know the answer to that because the experts can't agree. And unless somebody from Apple comes and explains the timestamps on the Safari tabs, we're never going to know fully.
Talked about what happens to the brain. Can I ask you a couple of detailed questions about that?
Sure.
When you explained that the brain upon impact then shifts forward and hits the front of the skull, is there a medical term for that process?
Well, the medical term is a coup contre coup injury. So the coup is when you first hit. In this case, it was the back of the head. as summarized by laceration in the back of the head and the contusions that the pathologist and the ME found in the back of the brain. And then the brain shifts forward, and as it's traveling at a certain velocity, because it's thrust forward on the floor of the base of the skull, it's getting bumped, and it's getting, again, you can think of it as a hammer hitting a thumb. It's getting black and blue in the areas that are sharpest.
Are there symptoms that result of the process coup counter coup?
This is clinically, it varies. I mean, you can go from anywhere from a simple concussion where you sort of are unaware of what happened, but you're still awake, you're confused, all the way to, ultimately being in a coma.
Can this type of injury, the coup counter coup, and what you see in the review of your files, could this type of injury happen from an attack by a weapon, like a bat or a hammer?
Well, he did not have a depressed skull fracture. So any focal hit like that would more likely than not have caused a depressed skull fracture. Blunt trauma, the way he had, the assumption, would cause the coup counter coup without a depressed skull fracture.
When the coup counter coup process happens with the skull fracture, does anything happen to the front of the skull?
Well, you're asking me, does the forces, depending on how hard they are, can generate fracture lines all the way to the anterior fossa. So you can have fractures along the lateral temporal area. You can have fractures along the orbital roof. The orbital roof is very thin. And
I don't know what dogs are barking at. God knows. So again, the anterior fossa is the front of the base of your brain, so the bottom of your brain. So like over the top of your forehead, the orbital roof is like the top of your eyes, if you think, but it's inside. So you're getting fractures as the brain is forced forward, getting fractures here, and which causes bleeding.
And so those forces can go all the way to that area.
Did you see any sign of orbital fractures in Mr. O'Keefe?
Yes, he had both the ME and the pictures taken, and the neuropathologist mentioned fractures of the orbital roof.
Do you have an opinion to a reasonable degree of medical certainty how those fractures occurred?
From the trauma.
Could you just explain a little bit how that would happen?
Well, as he fell backwards and he struck his head, it was clearly at a very high speed generated by the gravity. The bone, depending on the quality of his bone, the density, then generated forces. There's a certain amount of lateral give, and then you get a linear force going forward. It drives all the way up the clivus and forward into the anterior fossa where his orbital roofs lay. And this is why people like this get what they call raccoon's eyes.
Do you have an opinion whether the brain itself could have caused the orbital fractures?
No. The brain is a soft substance. You could literally put your finger through the brain. We often operate on people fully awake. The brain couldn't possibly cause a fracture. The fracture was caused by the forces generated through that clivus, that middle bone in the middle of his base of the skull.
Do you have an opinion to a reasonable degree of medical certainty whether or not the brain in any way could have caused these orbital fractures?
The answer is absolutely not.
In your study of the records and photographs and in your experience treating these types of injuries, do you...
No, there's no court today. The head of schedule, so Bev has given them the entire day off. They were meant to have court just in the morning, like half a day. But because of the head of schedule, she's given them the entire day off. And they've got Friday and Monday off because of Memorial Day. So if you're not in the US, then you're not going to understand why there's a holiday. Like, it's not a holiday for me at all. So there's no court until Tuesday. No. So That's why I'm spending my time doing this. And then tomorrow I'm going to do a live stream where I review Scotty Bellow's testimony, the medical examiner's testimony. So I want to listen to all that again. Now I've heard him.
Have an opinion to a reasonable degree of medical certainty whether or not a person would remain conscious or would be immediately unconscious after the impact of the ground?
Well, it's impossible to know whether he became immediately unconscious, but his injuries were very substantial. And it's more probable than not that at some point he quickly became unconscious and was unable to do functional activities.
What is functional?
So he wouldn't be able to check his text messages. He wouldn't be able to, unlock his phone screen and read Jen McCabe's message. And he wouldn't be able to lock his phone screen again. He certainly wouldn't be able to be walking 36 steps in 83 feet. If he wasn't unconscious, he would have been completely out of it and then slipped into unconscious, I think, very quickly. And he would have been unconscious for potentially an hour, 2 hours, I don't know. But it has to be sufficiently long for the injuries to occur inside his head that were found.
Activities mean?
The ability to, get himself up and about would be one of the functional activities. The ability to call for help would be a very significant cortical function. And that's why I was talking about, that there's a variation on the theme from a simple concussion to a severe.
It also would have been doubtful that he'd be able to even turn over. So the position that he was found in is very, very relevant. Now, didn't Kerry Roberts say that they rolled him over? So they actually didn't find him on his back. Now, to get that skull injury to the back of his head, right at the back of his head in the occipital region, he would have had to hit the back of his head. But if he wasn't found like that, and he was found in a different position, then how did he get in that position? If he was found on his front or on his side, then clearly he did not get this injury the place he was found. Now, Kerry Roberts said they rolled him over. I've heard Karen, and I can't remember which interview, said that they found him on his left side. And that's when they rolled him over. So it wasn't like a complete rollover. He was on his side and they rolled him over. So is it possible that he was able to, he landed on his back and he was able to roll over, like in a delirious state? Maybe, possibly. But I definitely don't think he would be able to get from his back to his front. But possibly rolling on his side. Possibly. If he wasn't knocked out straight away.
Severe concussion like this.
If a person does not have functional abilities because they are rendered unconscious, does their body, could it still move?
Yes, this is the interesting thing about our brain. So
what your body can't do is consciously make a movement like rolling over. He's talking about flailing your legs about, not a complete rollover.
the cortex, which is the top portion of your brain, can get separated from your brainstem functionally. And what happens then is that your body is not acting autonomically, meaning vegetative. So why does that happen? We think it's because as we were a caveman, and if a caveman became unconscious.
I don't agree with this. I don't believe that there's an evolutionary adaptive mechanism to do this when you're unconscious and a predator's getting you. Because the chances are, in your caveman days, if you were at this level of unconsciousness, you're not going to regain consciousness. Therefore, you're not going to regain consciousness to breed, to pass those genes that enable you to do this to the next generation. So I don't believe there's an evolutionary adaptive mechanism that wouldn't be necessary for this to happen. So I don't believe this part of his testimony. It's a nice theory. I don't believe it's real, though. I think, however, what he's talking about is reflex actions. And reflex actions happen due to triggering of certain nerves. But I don't believe it's a mechanism to protect you from predators. Honestly, I really don't. Like a startle reflex in a newborn baby, that's a reflex, right? Startle reflex. That's adaptive. But it's not after the newborn baby has had a severe head injury. It's a result of being startled. And that's like, it kind of, that movement, that jumping movement shocks a predator. And that's true. But that's adaptive because that baby goes on to become an adult and then, you know, regenerates, breeds, and sends their genes into the next generation. So I don't think it's the same kind of thing that he's talking about. So I don't believe this bit here.
As an animal came up to eat it, the animal would touch it. Well, you have these automatic movements. One of them is called decorticating, which is where you draw your arms like this and you throw your feet out. And then a worse neurological situation is when you decerebrate. Now you push your arms out along with your legs. And that would scare off an animal. So we think that over time, genetically, this is what happened to our brains in order to create these. But those kind of movements are not thought processes. In other words, your brain is not telling you, oh, you have pain, go ahead and decorticate or decerebrate. It's an automatic movement in response to pain.
I want you to take us back now to after the fall. Would Mr. O'Keefe, in your study and opinion, have died immediately?
No.
Can you show?
I don't. Yes, I'll tell you. There is very few things that you head injury where you would die, quote, immediately. So if I took a knife and stabbed you in the back of your neck right below your skull and I drove it through your brainstem, you would probably die immediately. If I shot you below your ear and went through and through below your ear and shot through your brainstem, you would die immediately. But traumatic head injuries, you would not die immediately. It's a process. And it's a process of a combination of things. Brain swelling, which takes a while to develop. Decreased blood flow to your brain because you're getting swelling. And ultimately, death of the brainstem that controls your heart and your breathing. And so this is why there's a whole big issue about brain death. You know, when is someone brain dead? Because it's not instant.
You're only brain dead when your brainstem's dead. If your brainstem's functioning, you're not dead.
And it can take a long time to...
That's why people can be in comas for years and they're not dead. They're still breathing. Now, if you're using a machine to keep your quote unquote breathing and your brainstem dead, then you might look alive because you're being, you're artificially breathing. But you can be in a coma for years, breathe on your own, but just have absolutely no consciousness whatsoever. And if the only thing that's working is your brainstem, the chances of you regaining consciousness are practically zero, just so you know.
To be conceived. In these injuries that are very severe that we took care of, there was a high mortality rate. In the linear skull fractures, it was about 67%. But it took time for them to die. It could take days to weeks to months. And also, these people got to shock trauma. So it was a while, whether it was hours, before they were even starting to be taken care of. And yet they weren't dead yet. That's why I don't think it was immediate.
Was there any other observations you made about Mr. O'Keefe or his body that support your opinion that he didn't die immediately?
Well, the medical examiner took pictures of his periorbital area and diagnosed raccoon's eyes. So raccoon's eyes occur because there's leakage through the orbital fractures into the periorbital space. Normally, it takes about 24 to 48 hours to develop. It has been noted as early as 1 to 3 hours, which would make it not immediate.
So at the earliest, he's saying the raccoon eyes that John had would have taken an hour to develop. And you've got to be alive for that process to happen. So he had to be alive for at least an hour. At the very, 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 very least. Now, could he have been alive for a few hours? Yeah. Absolutely. Which leads some credence to the possibility that that text, "How's long to die in the cold," did indeed happen at 2:27 and 40 seconds.
Could we please have Exhibit 14? Dr. Wolf, could you share with us what you see here in this picture?
So right here, you can see the black and blue that sort of configures if he had his eyes open, like what we describe as raccoon's eyes, right? And that's not caused by direct trauma to his eyelids. It's caused by what I described as the basilar skull fracture, which went to the anterior fossa, which is right over the orbit here, inside, with leakage of blood products into that periorbital area.
You mentioned that starts or takes at least 1 to 3 hours to begin.
Minimally, yes.
You take that down, please.
Minimally. So he could have been alive for 3 hours, couldn't he? And this is minimal. Minimal. What's wrong with raccoons? Raccoons are cute. We don't have raccoons here in the UK. If we did, I'm sure Cassie would be very interested in them. She'd be interested in catching one, I'm quite sure.
If Mr. O'Keefe had been brought to a trauma center or emergency room, what would the process be in your experience?
Well, he would have been intubated if he wasn't intubated in the field. One of the first things you need to do in a head injury is control the airway. Why? 2 reasons. 1, you want to have enough oxygen going to the brain to feed it. And 2, you want to keep the carbon dioxide down because that causes increased intracranial pressure if it elevates. So you want to constrict the blood vessels a little bit. Then he would have had a CT scan immediately in order to assess whether he has a surgical head injury, meaning he needs to go to the operating room to evacuate something or not. During that process, he's obviously going to be getting medication to decrease the brain swelling. And from there, you make decisions based on his neurological function and what you're, capable of doing to, spare the brain from the rest of the injuries that will result. One of the things that occurs with contusions is a great medical term is they can blossom, which means they can get bigger. And if they get bigger, they might require surgical intervention to decrease the pressure as well as the volume of the blood that's destroying brain. And so you do serial CT scans in these patients over time, anywhere from every 6 to 12 hours to on a daily basis, depending on what the case-by-case, production of blossoming is occurring.
You mentioned that about 2/3 of your patients who suffer this injury pass.
Correct. What we saw is that in the patients that suffered linear clavicle fractures, 2/3 of them ultimately went on to die, and 1/3 lived.
Is there commonality on how they pass?
One of the common reasons they passed is if they trapped a major vessel in one of the fractures, they would get a significant brainstem infarct, meaning a stroke, meaning lack of blood flow to a very significant portion of the brainstem. And so that was one of the causes of death that ultimately we understood. And then the others died from the increased intracranial pressure that drove the brainstem down through the foramen magnum.
Did you review any materials that talked about or identified Mr. O'Keefe's body temperature when he was treated?
As I recall, his core temperature was 80 when he was found.
Is that significant in the process and development of his injury from the moment he fell and hit his head?
Now, if I'd have been Alessi, I would have objected to this because this dude is a neurosurgeon. He's a brain surgeon. He's not treating hypothermia. I would have objected here.
until his ultimate passing?
Well, hypothermia, I mean, if you define hypothermia, it starts at 95 degrees. Your core temperature is usually about 98, 98.6. 95 is very mild hypothermia. When you get to 82 degrees, you're in severe hypothermia. What happens when you're hypothermic, and I'm a neurosurgeon, but I can tell you that you get into multiple organ failure. Your heart starts to have problems. It can have arrhythmias. You're not breathing. And ultimately, at hypothermia, you also become unconscious and go into a coma-like state. Below 80 degrees, you're probably going to die. So all I can tell you, it wasn't helpful that he had a significant head injury and that he was then found hypothermic.
Is it uncommon in your experience?
Well, if he was outside and it took him several hours to die, then he would be hypothermic. Like, you can't develop hypothermia when you're dead. And this is what I've been saying. If you're already dead, yes, your body cools down and your body shows like evidence of being cold, but it's not the same process as developing hypothermia. But if he did have evidence of hypothermia, and this is now contested, and this is why it's going to be important to review the conversation that Alessi had with Scotty Bello, if he didn't have significant hypothermic evidence that would have developed while he was alive, then he had to be somewhere warmer, at least for a period of time. But personally, I think he possibly was outside the whole time, not on the front lawn, but outside the whole time. And that would explain why he did have some hypothermic symptoms. Then again, I'm not a medical doctor.
People that suffer this injury to pass within 5 hours?
Well, none of the patients we treated died within 5 hours, but it also didn't mean that we didn't realize that they were going to be in a potentially vegetative state. When someone's hypothermic, you have to warm them up in order to establish a clinical status, meaning you can't declare someone dead with a temperature of 80. You have to warm them up slowly, appropriately, and then reevaluate where they are clinically.
I've asked you questions about whether you had an opinion.
That's true about frostbite. Now, you can develop frostbite after your death. I think it looks slightly different than developing frostbite while you're alive. But if you didn't have any frostbite, that's very interesting. That's very interesting.
About Mr. O'Keefe and when he died, I want to ask it in the form of a formal opinion. Do you have an opinion to a reasonable degree of medical certainty whether Mr. O'Keefe died immediately or within 15 minutes?
No, I don't think he died immediately. Neither the hypothermia nor this kind of head injury would kill you immediately in any.
I don't know why Hank chose 15 minutes. That seems very arbitrary.
Clinical experience I have.
Dr. Wolf, thank you.
How do I explain the stair climbing if in the backyard? Well, according to Ian Whiffin, the stair climbing happened before the vehicle stopped. The stair climbing happened like 12:22 to 12:23-ish. And the vehicle was still moving. So according to Ian Whiffin, it's going up a hill. Now, we've had this conversation. I talked about this when Ian Whiffin testified, but it does appear that the vehicle was moving when that stair climbing event happened. So the backyard would have been after that. The backyard would have been between 12:31:56 and 12:32:16. That's the 83 feet walk, and that 83 feet walk would have taken him from the curb to the backyard.
All right.
Let me have a moment, Your Honor.
Sure.
Thank you.
All right, Alessi's cross. Now, this is not long. And I kind of, when he finished his cross dead quick, I thought, there's so many other questions that I would have asked him. But I think Alessi did the right thing, because Alessi got what he needed. And then he's not going to push it, because he doesn't want then the witness to start talking about stuff that Alessi doesn't want him to, that doesn't support his viewpoint. It's better to wait until his witness, till the defense medical witness comes on. So I think Alessi played it really well here. I didn't think so originally. I thought, oh, there's so many more questions he could have asked. But I think he played it well, because it sets up the defense witness. It gives the foundation for the defense witness. Could the dog have attacked him and then he fell over and got his head injury? That was, I did a whole video on that. I did a whole video on that before this trial. That it was one of my possible things, that he could have got in the backyard. Chloe's attacked him and Albert's panicked. The Alberts panicked because Chloe had attacked him, and they found John unconscious, and they panicked and they did the wrong thing. That was one of my theories.
May I, Your Honor?
Yes.
Morning, Doctor. I don't think we've had the pleasure of meeting. Welcome.
Thank you.
Sir, can you just describe, you started to do it a little bit on direct, a typical day for you?
I wake up at 4:15 in the morning. I go to my center. I set up patients with frames for their either radiosurgical procedures or stereotactic craniotomies. I go home. I make a cappuccino for my wife.
He makes a cappuccino for his wife. So he goes all the way home to make a cappuccino for his wife. I'm sorry. I'd tell her to make her own cappuccino. I'm sorry. Yeah, I'm very busy. I got brain surgeries to do. I'm not going to go home to make a cappuccino. But anyhow, that's something the jury's going to remember. Look at Leslie's face.
6 o'clock in the morning, and then I get back to work at 6:30 and move on. I have patients that I'm operating on, and I have patients that I'm seeing through the day.
What type of patients and what type of work? Just in a typical day. What are you doing? What type of patients and what do you do?
It varies. I mean, I see patients with brain tumors. I see patients with hydrocephalus, which is water in their brain. I see pediatric brain tumors. I see subacute and chronic subdural hematomas, post-traumatic. I see patients with strokes that are being misdiagnosed. I see patients with cancer, metastatic disease. I used to see patients with cervical problems. I stopped doing that 2 years ago. I mean, I don't know what else you want me to tell you.
No, that's great. And is that typical day, typical of the type of days you've had for the past month, past few years? Is it generally, without specifics, is it generally?
Correct.
So none of your typical days, none of the past typical months have involved forensic pathology, have they? You haven't acted as a forensic pathologist.
I am, you could have asked that question, very straightforward. I am not a forensic pathologist. I'm a brain surgeon.
Right. and you
I like how blunt he is. As opposed to the next witness, Christina Handley, who can't even say yes or no. I welcome witnesses like this who just cut to the chase. Not a forensic pathologist, not dealing with dead brains, is dealing with alive brains. However, the injuries to John O'Keefe's head were created when he was alive. Now, in Florida, I'm not guessing. I'm guessing he's not going to see very many head injuries where people have fallen on ice or fallen and gone unconscious and then had periods of, hours where no one finds them and they're hypothermic and they die. I'm guessing that that's not the content of his practice. But when he lived in Minnesota in the 1980s and he worked in Minnesota in the 1980s, then yeah, you're going to see a lot of those types of injuries, which are more akin to what John O'Keefe suffered from. But Alessi is obviously getting at, well, yeah, you're very experienced, you do a lot of good work, but you're not dealing with dead brains.
You don't perform autopsies, correct, sir? You're a brain surgeon.
Correct. In other words, I see more brains than the forensic pathologist.
Right. And is it correct to say that the brains that you see are of living people?
Correct.
Okay. So what I'd like to do is to go to a different part of the head than was discussed, but sticking with the decedent.
Excuse me, I didn't hear the last
I'm
word.
sorry, with the topic is going to be Mr. O'Keefe, the decedent in this matter, sir. You testified about raccoon eyes. The medical term for that, sir, is ecchymosis, right?
Correct.
And ecchymosis, raccoon eyes, does not cause a laceration to form on an eyelid, does it?
No.
Are you aware that Mr. O'Keefe had a laceration to the outside area of his right upper eyelid?
I am aware that the ME described that. Yes, sir.
Now, could, Your Honor, I'm going to, with Your Honor's permission, ask to publish what is already in evidence in a moment.
Okay.
I have a video on dog bites on this channel. I'll show you after this. It's nearly finished.
Mr. Wolf,
What exhibit number, Mr. Alessi?
we're going to, 165, Your Honor?
Okay, go right ahead.
Thank you. Dr. Wolf, have you seen this photo depiction before today?
I believe I have.
Is it correct that that injury on the upper right eyelid is caused?
Is Alessi really in his 60s? No. He looks about 12. Seriously. He's not in his 60s. No way. I'd put him at 40 tops. No. Unless he's 67. Seriously, no. Robert Alessi is 67. No way. Good God. Good God. No way. Oh, he looks about 12. I know when you get older like me, everybody looks young. There's no way he's 67. No way. I want to know his secret. I want to know his secret. He's bumped to the glare poster flexing. No. Good God. Okay, I'll believe you all, but I thought 40 tops, 45 at the very, very outer limit. Yeah, the portrait's in the attic. It absolutely is. It absolutely is. He is Dorian Gray. Yeah, without a doubt. Without a doubt, he's Dorian Gray. Dear me.
Caused by the application of force directly to that area of the front of the head, again, namely the upper eyelid.
That's possible, yes.
Is it more than possible? Is it probable that that injury was caused by the application of force directly to that area of the front of his head?
Well, an easy answer to that would be is that that's not part of the periorbital ecchymosis.
Thank you, sir. That was exactly going to be my next question. This injury is unrelated to any of what you've been describing, the fall backwards, the force transfer inside the skull, the, as you described it, the dura, the cerebral spinal fluid, all of that dynamic that you so ably described on your direct examination. This injury has nothing to do with that, correct?
Correct.
And that's all the lesson needed. That there's an injury on John O'Keefe's face that was not caused by him falling backwards and not caused as a result of his brain bleeding. Like the raccoon eyes look like black eyes. It's not because he was punched in his eyes. It's because there's blood building up behind his eyes, right? And it's building up. Unless he's got what he needed. So there's so many other things he could have said, but no, he's got what he needed. Stop there.
I have one more moment, Your Honor. Thank you.
I bet he had a bunch of other questions. So he's thinking, should I leave it there? Should I leave it there? That's what I'd be doing. I'd be debating. Should I leave it there? End on a high.
Thank you for answering my questions, Dr. Wolf. A pleasure again. No more questions at this time, Your Honor.
Any brief follow-up on that?
No, thank you.
All right, Dr. Wolf, you're all set, sir.
And they didn't expect Dr. Wolf to be on the stand for such a short amount of time. But him saying, this very eminent brain surgeon, to say that the injury to John's eye, the laceration, the cut to John's eye, was not caused by a fall backwards or the result of the fall backwards, is really significant. Really significant. Yeah, Dr. Wolf looked kind of disappointed. He was expecting, I think, a long cross-examination, but it wasn't needed, because that sets up in the jury's mind. You got reasonable doubt. You got them thinking, but he can then get his witness to expand on all of that in a way where, unless he knows, he knows what the answers are going to be. That, it's his witness. So, yeah, I thought it was really good. I thought it was really interesting. Because I'm interested in brain, so I was interested in this testimony anyway. I'm generally interested in medical testimony. I'm generally interested in, like, the technical stuff, like phone data, that kind of thing. I'm going to be really interested in the accident reconstruction, because I think I'm going to learn a lot. It's not an area that I know a lot about, so I think I'm going to learn a lot. I learned a lot from ARCA last year, so that'll be good to hear again, plus the extra that they've got, and the prosecution's witness. I want to hear Dr. Welcher, see what he's got to say. But I especially like the medical stuff, like autopsies and things like that. But I do have a video on dog bites, and I'm sure it's on this channel. Hold on a minute. Let me find it. It's from a while ago. But this is this channel. not Michelle After Dark. Come on, you can do it. Yeah. It's got a picture of John O'Keefe's arm on it. It's not as far as 2 years ago, so I've missed it. That's the problem with having 2 channels. Like, I never remember what's on what channel. There it is. There it is. John O'Keefe, let's talk about dog bites. So that's what you're looking for. And what I've done, I'm not going to play it all. This one also, but I explain what I think is going on. So I originally said that they were bites, but I'm not sure they are. They could be bites, they could be scratches. Those 2 are scratches. Those are scratches. That's definitely a bite. You can even see the bottom teeth there, which have not quite connected. You've just got this bruise a little bit. But that's a bite. Like, that's a bite at the elbow where Chloe's not been able to actually connect. So she's been nipping. It's more nips, and it's very superficial. And then these 2, I thought, were also bites, but looking at them again, I think there's possibly scratches. So I think the bite's here, and then these are scratches. But as he's bending his elbow, she's not been able to actually bite him properly. So very, very superficial, but there's nothing about this that suggests that it was done by a motor vehicle. That's the main point. That's the main point. But I do have on Michelle After Dark, I do have a video about my theory about the backyard. That was before this trial. Here we go. So 2 months ago, how did Boston cop John O'Keefe actually die? A tentative theory. So if you want to go and listen to that as well. All right. Okay, so I'll be back tomorrow to talk about Dr. Scotty Bellows' testimony. Going to review that. So join me. We've got all day. We've got all day because there's no court until Tuesday. So if you fancy reviewing Dr. Scotty Bellows' testimony with me, then join me. It will be on this channel, Michelle Walks. And I'll start probably about the same time as I did today. So it's going to be a longer one. I might not like start it right from the beginning. I might start it from where she starts talking about his injuries. But we'll review it together, and we'll also review the cross-examination because there's an interesting discussion about hypothermia. So, all right, guys, thank you for joining me as always. Thanks as always to the mods. Did I get any donations? I don't think so. No, I didn't. All right. Enjoy. I've got a video on Michelle After Dark that I'm going to release within 10 minutes about the dog search in Lily and Jack Sullivan's case. So talking about dog searches again. So I'll release that within 10 minutes for those who are following the disappearance of Lily and Jack Sullivan from Nova Scotia. So until tomorrow, enjoy the rest of your day. I'll see you soon. Bye, guys.